A group of teachers and frontline workers came together today to call for paid sick days in order to ensure a safe return to schools and to protect against a possibly devastating second wave of COVID-19. According to them, 58% of workers in Canada don't have paid sick days. Many of them are working in low-wage, precarious jobs. They say governments must act now to provide paid sick days for all workers on a permanent basis.
It would make all of the difference. I think what we really have to think about is this, not just terms of politics. We have to think about what this means. We know on a permanent level, paid sick days are important. For example, we've got the flu season coming up, right? And we know exactly how important paid sick days are for parents, especially those who are sending children to school as schools reopen. They're protective to prevent against these, potential fall peaks.
The Decent Work and Health Network has released a report written by health providers that they say reveals how Canada's paid sick day policies lag behind globally. The report notes that cities with paid sick days saw a 40% reduction in flu rates compared to cities without. And researchers say there is no question infections often spread quickly and easily in workplaces. They say the federal government's temporary sick leave program is not enough, that paid sick days must be permanent, universal, and free of barriers like sick notes.
If I send a staff home because they have a cough and it turns out that it's not COVID-19 related, is it still covered? Because then it's not related to COVID-19. So that staff now has to take time off because they're following the recommendations of public health, but that day is not paid.
The report also points out that 76% of physicians surveyed said they write at least one sick note a day, and 83% agreed that visits to the doctor for sick notes are unnecessary and a waste of public resources.